Real Housewives of Atlanta star Gregg Leakes announced on June 28th that her husband Gregg's cancer had returned. During an exclusive interview with the Jasmine brand, Gregg made the announcement while asking for prayers. She added that he had undergone surgery and was expected to be released in about 10 days. She also said that Gregg had been in the hospital for a week and had this type of surgery before. Gregg was first diagnosed with stage 3 colon cancer in 2018. He began chemotherapy treatment, and in September 2019, Gregg said on an episode of The Wendy Williams Show that Gregg was cancer-free since May of that year. However, on September 1, 2021, the family's publicist confirmed to Variety, "After a long battle with cancer, Gregg Leakes has passed away peacefully in his home surrounded by all of his children, very close loved ones, and wife Gregg Leakes." Colorectal cancer is the third leading cause of death in young adults, and people born after 1990 are twice as likely to be diagnosed with colon cancer than people born in 1950. While the overall number of colon cancer cases in adults over the age of 50 has dropped, more younger people are being diagnosed, according to the Colon Cancer Coalition. Colon cancer begins in the lower part of the large intestine or rectum, and it can go undiagnosed until it reaches late stages, much like it did in Gregg Leakes' case. In the early stages, polyps can appear, but the presence of polyps does not necessarily mean cancer cells are present. In addition, polyps may be too small to detect. That being said, polyps are not always present when there is cancer, which makes it tricky to diagnose. It is not clear why polyps form. While anyone can develop them, people who are overweight, those over the age of 50, and people who have uncontrolled type 2 diabetes seem to be at greater risk. Individuals who have had them before are likely to get them again, and polyps are likely to form in those who have digestive issues. Most physicians recommend rectal screenings and removing polyps when they are found to reduce the risk of developing cancer, according to the Mayo Clinic. Colon cancer is divided into different stages, and some stages are further broken down into phases. In the earliest stage of the disease, known as stage 0, the cancer has not moved beyond the inner layer of the colon. The next stage, called stage 1, indicates that the disease has spread beyond the inner layer of the colon to the submucosa. In stage 2, the cancer has expanded beyond the submucosa. This stage has 3 phases, commonly referred to as 2A, 2B, and 2C. In stage 2A, the cancer has not passed completely through the colon. In stage 2B, the cancer has grown through the outside of the colon, but it has not yet made it to the lymph nodes. In stage 2C, the disease has spread to nearby organs and tissues, but it has still not made it to the lymph nodes. Similar to stage 2 colon cancer, stage 3 also has 3 phases. In stage 3A, the cancer has made its way to nearby lymph nodes. Stage 3B indicates that the disease has moved to the outer layer of the colon, nearby tissue and organs, and has been located in some lymph nodes. This stage could also indicate that the cancer has been discovered in at least 4 lymph nodes, but the cancer has not yet passed through the outer layer of the colon. Stage 3C means the cancer is found beyond muscle layers and is present in at least 4 lymph nodes, but it has not yet made it to distant tissues and organs. Stage 4 colon cancer is separated into 2 phases. In the first phase, the cancer has spread to a distant organ, such as the liver. In the second phase, the cancer has been discovered in more than one distant organ. Sometimes, symptoms of colon cancer do not appear right away. It can often be misdiagnosed as irritable bowel syndrome or even hemorrhoids. It is also worth noting that in stages 1 and 2 of the disease, there are very few symptoms. There may be bleeding, but it is so light it is not easy to detect. However, sometimes a tumor will create a blockage in the intestine, which makes it easier to identify. Some signs of the disease that become present in stage 3 include a change in bowel movements, including diarrhea, constipation, and narrowing of the stool. Another symptom is blood in the stool, which would turn it a dark brown or black color. Rectal bleeding is another sign, which would look bright red. An urge to have a bowel movement after just passing one is another sign of colon cancer. Pain in the abdomen is also a symptom, as well as weight loss, fatigue, and weakness. The survival rate of the early stages of colon cancer is relatively high. Those diagnosed with stage 1 colon cancer have a survival rate between 80 and 95%, and those with stage 2 have a survival rate between 55 and 80%. Most cases of colon cancer occur in older individuals. However, it seems that people with other intestinal issues have an increased chance of developing colon cancer. A family history also raises the chances of getting the disease. Lifestyle factors also play a part in who might be diagnosed with the disease. To help reduce your risk, the CDC recommends staying physically active and eating a diet that is high in fiber, fruits, and vegetables. The organization also pointed out that consuming high amounts of processed meats, smoking, and drinking alcohol can increase one's risk. The chances of colon cancer returning depend on when it was first diagnosed. The disease is less likely to recur if it is discovered in stages 1 or 2, and more likely to recur in stages 3 and 4, as was true in Gregg Leakes' case.